Good afternoon. I'm DJ Wells of the Urban Health Program at the University of Illinois at Chicago, and this is Urban Health Hotline, where each week you'll have an opportunity to call in and have your questions answered about opportunities to pursue a degree that might lead to a career in healthcare. We'll also talk about educational opportunities that are available at the University of Illinois at Chicago and elsewhere. And we'll talk about important issues to our community, issues of health disparities, issues of educational access, all those things that might be of interest to you and of help to you as you think about where you might want to go professionally. Remember, this is a call-in show. It's your show. So anytime that you have a question about any of the things that we're talking about today, feel free to give us a call. The number's right there on your television screen, right there at the bottom, 312-738-1060. The lines are open now, so give us a call at any time. I'm joined today by Mr. Chris Biddle. Chris oversees several exciting opportunities. We talked about educational opportunities, and today that's what we're going to talk about, because Chris oversees several exciting opportunities for people who are interested in pursuing the business side of healthcare and healthcare management. So, Chris, thank you for being with us today.
Thank you for having me, DJ.
Now, Chris, I know you work with an organization called the Institute for Diversity, and that's a part of the American Hospital Association. Can you kind of tell us, first off, what is the Institute for Diversity, and then how is it connected to AHA?
Sure. The full title is the Institute for Diversity in Health Management.
Okay.
It's a subsidiary of the American Hospital Association. And the purpose of the Institute is to support diversity and inclusion programs within hospitals around the country. So our overall goal, what we eventually want to head towards, is a hospital staff that reflects the community around them, racially and culturally.
Okay. And you said you're an affiliate of the American Hospital Association. What exactly does that mean, that you're an affiliate?
Sure. The American Hospital Association is one of three organizations that created the Institute for Diversity.
Okay.
In 1992, there was a benchmarking survey done of all the national hospitals, and it was revealed at that point that less than 10% of the administrative staff for hospitals were racially diverse. It was a very low number. I think it was actually even as low as 2 or 3%.
That doesn't surprise me.
Right, for 92.
Yeah.
Well, so then the American Hospital Association, the American College of Healthcare Executives, ACHE, and the National Association of Health Services Executives, which is an African American support organization for hospital administrators. It's also called NACI. They came together and formed the Institute, and it began its programming in 1994, and it's been going strong ever since.
Very good, very good. Now, I understand you said you've been going strong. Just how strong is strong? I mean, and I would imagine that, you kind of had your growing pains early, but
Sure.
But I know, because of the work that we do, that diversity in healthcare is becoming more and more of a catchphrase these days. So I would imagine that the Institute for Diversity is seeing similar types of things.
Yeah, you would be spot on, DJ. We just did our benchmarking survey in partnership with HRET, the Health Resources and Education Technologies, I believe. It's another subsidiary of the AHA. It's going to be all acronyms.
I was just going to say, it's lots of letters for you today.
We're playing Scrabble, basically. We partnered with them for a survey. Approximately 900 hospitals responded, and they gave us their racial and cultural makeup of hospital administration staff. And what we found is we've grown to almost 9% of hospital administrators are racially diverse. So it's growth. Granted, now that's been almost 20 years, coming up, 18 years. But we're definitely seeing a penetration into those higher levels of hospitals, which more accurately reflects the community around them, because obviously the numbers in the communities are much higher.
Yeah, certainly if we look at it, and you talk about surveys and studies and the like, and one survey or study that we've referenced several times on this program, when we talk about needing a more diverse workforce, certainly in healthcare, but in general, is that the studies that we see all the time that what was it that I just saw one recently, that more than 50% of all babies born in the United States last year were minorities. They were part of a group that would be termed an underrepresented minority group in this country. So certainly the population is shifting, so we need to see these shifts on the professional level as well.
Yeah, we're hitting almost a tipping point.
Yes.
Where the minorities are becoming the majority. And it's going to be interesting to see how culturally that plays out in every aspect of our society. But we're definitely heading towards that point. I think the largest growing groups are Hispanics, and then African Americans behind them. But that's what the numbers are starting to show. And it seems to me, and I'm an optimist, but that we are inevitably heading towards a point where all the businesses will have to reflect the community around them, because those are the people who are there to do the work.
Absolutely. There to do the work and there to be the customers, or in the case of healthcare, the patients.
Right.
So why is it important then? And of course I know the answer, and it should be obvious to anybody, but it still merits being said out loud. Why do we need African Americans, Latinos, Asians, Native Americans running hospitals and health care systems rather than just being doctors or nurses or pharmacists or dentists?
But positions of leadership.
Exactly.
It's interesting. This is a big question, obviously, and there are several correct answers that kind of give an insight to it. But one of the ways that I like to think about it is that specifically when you think about hospitals and think about patients and their relationship to a hospital, typically people are, in most cases, not going to a hospital for a joyous occasion that brings them volunteering into the door. Like, they're thrilled for the experience.
Right.
Typically there's some type of illness involved or some type of injury.
Right.
If not for them, then for a loved one. And that's what brings them to a hospital. So the opening contact with that hospital is one that it carries a lot of baggage with it emotionally.
Sure.
So now imagine they're walking into a place, maybe they don't speak English, or maybe it's not their primary language. Right. And all of the language being spoken around them is English, and all of the signage visible to them is in English. What would that experience be like if they're going to attempt to care for someone who is very important to them that is injured?
Sure.
And then beyond that, what does it feel like to see the people around you that represent a culture that is so foreign and so alien to you? So it is important to have a connection in a hospital to the people that represent something that you're at least familiar with. So you're more likely to engage in a hospital experience, and therefore find coverage that support that you would need so that you don't stay sick longer.
Right. Now, of course, we could say that then the important folks for the patients in the example that you've just shared would be the nurses and the doctors. How does having an African American or a Latino, if we're talking about language barriers, or an Arab or an Asian executive, change that scenario? Sure.
Well, then it all comes down to connection between the hospital and the community. And keeping in mind, most of the hospitals are community owned. So that type of connection between them is critically important.
Absolutely.
So you need to have someone in a leadership position who comes from a place of understanding who the people are around them that they're servicing. And without it, you're going to walk down a lot of dead alleys that don't have a lot of leads for things that are actually useful to people in the community. You'll waste time, you'll waste resources, and more importantly, you'll prolong the process between the connection between the community and the hospital. And that's just wasted time and wasted resources.
Absolutely. We're with Chris Biddle from the Institute for Diversity for Health Management. All of these, like we said, it's alphabet soup here.
Right.
We'll just say IFD.
Sure.
But we're here with Chris Biddle from IFD of the AHA. And remember, this is Urban Health Hotline. And if you've got questions about anything that we're talking about, or if you just want to chime in, if you agree with anything that we're saying, then by all means, give us a call at 312-738-1060. Now, Chris, a lot of what you were just talking about, the connection to the community, the understanding of the community. I know that I know that a major buzzword or catchphrase these days in healthcare is cultural competency. What is cultural competency as you see it? And we've talked about it with other people that is, before on this show, we've talked about it in discipline-specific areas. But, when we're talking about it in terms of an entire healthcare system, what does it mean to be culturally competent?
Sure. Well, the way that I like to think about cultural competency is a two-part process: coming and going, sharing of information. So there's knowledge of self, your own experience, your own race, your own culture, your own background, how you grew up, who you grew up around, what they ate, where they went, what their experiences were like interacting with other cultures around them. That's knowledge of self. Then there is knowledge of the other, something that is external to you.
Sure.
And that's where you often find yourself in conflict. The things that we know about ourselves, well, we have an easier time with that. But the things that we don't know about other people can sometimes be scary or off-putting, or will put up barriers for people to interact with them. So there's knowledge and acceptance for the other, for other races and other cultures. Cultural competency says the basic tenet is that it's important for you to know yourself, know where you come from, but be open to the sharing of attitudes of things that are different to you. And that is the core of it. Tolerance, patience, and an openness to understanding things that are new to you.
And from my own understanding of cultural competence, I think understanding is perhaps key. You mentioned before the idea of going into a hospital and understanding that it's important to have multiple languages represented on the charts on the walls, so that people feel that this is a place that I can be comfortable, that I can get information that's going to be necessary for me. And also understanding of, certainly we've heard the horror stories of the past, where they're, you hate to say it, but there's reasons for some cultures to be mistrustful of the healthcare industry.
Maybe, and that happens.
And therefore there are those cultural barriers that have to be at least understood and appreciated, so that, and unless you've got somebody in leadership who understands that, then it's hard to break down those barriers. It's hard.
Well, and there's also ingrained behavioral tendencies that to us are on a subconscious level that we're not aware of that could be offensive to other people. There are some cultures that are uncomfortable if you're physically touching them. There are some that eye contact for them it feels aggressive. And if you are not culturally competent, then you're not aware of those differences within your community. I was reading just the other day, as a brief aside, I was reading a report from a hospital that has done a lot of outreach to an Amish community around them. Which, again, when you think of minorities, is not the first direction you tend to go. But they definitely qualify. And the way that they interact with their society and with technology and with, just basic medical support is totally different from what the hospital does. They had to really work very hard to understand those people and what their needs were so that they could support them, and support their community. Those are the kinds of challenges you're facing.
Absolutely. So then tell us specifically, what is IFD, what is the Institute for Diversity doing to address this issue of cultural competence? I would imagine that you're reaching out to some of those hospital leaders and saying, hey, this is important.
Yes. Well, our flagship program, the thing that draws the most attention, is our biannual conference. We just had it in June in Nashville, Tennessee. You might have heard about it.
I was there, actually.
And that draws in, I think there were between 350, 400 people, if I remember the numbers correctly. And that is a gathering for a weekend of people who are in their hospitals responsible for the diversity and inclusion programming. So to get them all together in one area and share discussions from leading authors in the field, new techniques, that gives them the support that they can go back to their hospital and be better at the work that they're doing.
Mm-hmm.
And then for hospitals that don't necessarily have a strong diversity program, this is their chance to kind of get to know what is possible.
Sure.
So that's the biggest program that people involved with.
And let me interrupt you for just
Sure.
a second, just to say that I was at that conference, and it was an outstanding conference, and it really is. It's inspiring. It's uplifting. It's it kind of gives you the feeling that you can get things done when you're in a room of like-minded people, and you're sharing best practices, and I did this. We thought we did this kind of okay, but it could have been better. And to have other people in the room who speak the same language and say, well, have you tried this or have you thought about that, really made a difference in the way that we have been approaching things in terms of teaching our students about cultural competence.
Oh, that's excellent. That's what you want. It's interesting to have it as a theory. It's even better to see it in practice.
Absolutely. So what else is IFD doing?
Well, a second program of ours that's very popular is our monthly diversity dialogue webinars, where we have a professional out in the field come in and give an hour-long presentation, usually during the lunchtime hours, so that it's easier for people to call in. It's free to all the members of the Institute. I think there's a $99 fee if you're not a member of the Institute, but that can also be applied towards your membership to get you in the door.
Right.
There's the marketing pitch.
Very good.
But the call-in response to those has been very strong. That's another thing that's very popular. We also have, briefly running over the program, we also do on-site consultations where President and CEO Fred Hobby will come to your hospital. We'll assess the situation as it currently stands, how aware you are in cultural competency, and then make recommendations for ways that you can improve your programming. That's been hugely successful. He's one man. It's hard to get him to book him if you get him, but the hospitals that get him to come out and lend his expertise see a phenomenal uptick in their awareness.
Good.
Also, our certificate, CDM, the Certificate for Diversity Management. Okay. It's a year-long program that we partner with Georgetown University. We have professionals in the diversity field that do your phone training, online video training, and then I think they have quarterly meetings, that sort of thing, so that you can end up with a certificate in diversity management that will help propel you forward if diversity is a career path you want to go down. Sure. And then Emerging Leaders, which is our program to help diversified management candidates transition out of that into the C-suite. So the tips and techniques that they need to learn to capture the attention of the hospital administrators.
I believe we have a caller on the line who's got a question for us.
Oh, excellent.
Caller, welcome to the Urban Health Hotline. What is your question?
Hi, thank you. I wanted to ask the guest if he has found that people are simply more comfortable being seen by somebody who has the same background as they, or if they actually receive more accurate diagnoses and better care from somebody who has the same background as they.
Yeah, that's an excellent question. And yes to both is the short answer to that. But as we were just saying earlier, people are reluctant to go in and get the health care that they need. And to see the faces reflected back at them that they're familiar with, that's going to make it easier for them to get involved. Absolutely. I mean, this is not just speculation. There are reports that back this up. So it really is, it's critically important that the people in the community are represented in the hospital.
And it's a large part of why the Urban Health Program exists, recognizing that, and again, Chris, your program is dealing specifically with people who are on the business end who are making decisions about how a hospital or health system is run, but the Urban Health Program exists so that we can put folks on the front lines of that fight as well, so that there are doctors and nurses and dentists and pharmacists, all of them from a diverse background to reflect the diversity of our society that continues to become more and more diverse, so that folks do have the option of seeing someone who is from their culture, who understands who they are and what they might be going through. So thank you, caller, for an outstanding question. So, Chris, you were sharing with us a little bit about what IFD is doing, and I know that your specific area of focus is in education. Of course, education is near and dear to us here at the Urban Health Program. Tell us a little bit about what you're doing specifically in terms of scholarships and internships and opportunities for students.
Well, I saved the best for last.
Outstanding.
I like to save my own program because I can talk about that for hours, and I hope we have another hour to go.
We've only got about 5 minutes. So
okay, we'll speed through it. So there are 3 facets of the programming that I cover. One is our connection to Aramark. They have a very successful fellowship program, which this past year drew a lot of media attention. But it's basically a year-long fellowship of employment in Aramark hospitals.
Okay.
And I think I met 5 of those candidates at the AHA Summit, which was in June. Phenomenal, outstanding students. That's for students who are just post-grad.
Okay.
The other program is our scholarships. We have 4 of them that we administrate. Registration begins in October for those. They're specifically intended for minority candidates. And it's to give them a little bit of a financial boost to help them through their educational process.
Okay.
So there are 4 of those.
And those 4, they're intended for minority candidates, I imagine, who are specifically interested in the business end of healthcare, of going into management.
Going out for their MHA or a comparable degree.
Okay.
Yes. And then there's the summer enrichment program, which is near and dear to my heart. You and I have talked a lot about that.
Yes, we have.
But it's basically a 10 to 12 week internship in a hospital with a mentor on site as a paid internship for minority candidates who are going out for their MHA. We traditionally place about 30 students a year, and these are in hospitals around the country. So it's not just in your local community. You may be tapped to come out and do an internship in Los Angeles, California, or in Vermont, or in Pennsylvania. And the preceptor, the contact, the mentor on the host site aspect is somebody who is actively interested in your well-being.
Yes.
And they'll act as a mentor for you after your internship is done. So you're making those bonds in the 10 to 12 weeks that you're there. And in some cases, out of 30 kids that we'll place in a summer, usually up to 5 of those students transition from there into permanent full-time employment, either as soon as their internship is done, if they've just graduated, or they make that contact and then come back after they've graduated.
Outstanding.
And they begin their career at that point.
Outstanding.
That's exciting.
That it is. It's a wonderful program, and I know that you've had several successes in the program. Students that have gone on and done great things during those internships.
Well, now would be a good time to mention that this past year we partnered with the Urban Health Program.
Yes.
And in fact, the very first student placed in 2012, Miss Misha Cadet, was a UHP student.
Absolutely.
And not only that, but I do believe she was recently up for consideration for another position at the Illinois Hospital Association. So she's definitely a superstar. And our partnership with UHP has been great. Because you've presented us some phenomenal candidates.
Well, good. I'm glad to know that. Of course, we already knew that. We already knew
good.
that our students were outstanding, and we're very pleased to be partnering with the Institute for Diversity because we are, I think, together doing things that very well could make a significant difference in healthcare down the road.
Well, registration begins October 1st.
Okay.
So if there anybody that's watching that is interested, if you're an MHA student and that captures your interest, you can go to our website, www.diversityconnection.org, and then look for educational programming. The application form will be there October 1, ready to go.
Chris, we're just about out of time,
I know.
but thank you so much for being with us today. We really appreciate your time.
Thank you, DJ.
And thank you for joining us today as well. If you have questions or if you didn't get Chris's quick plug on where to go for their website, then by all means, take a look at our website and or give us a call in the office, 312-996-7727. We can refer you to Chris and to the Institute for Diversity and make sure that you have all the information that you need to take advantage of the great opportunities that they are offering. And also, we can provide you with lots of information about the opportunities that we offer here at the University of Illinois at Chicago to make sure that you have a good chance, a good opportunity to pursue your own professional healthcare degree aspirations. Please join us again next week for another installment of the Urban Health Hotline. For the University of Illinois at Chicago Urban Health Program, I'm DJ Wells. Thanks and have a good evening.